Hello, my dear friends. कैसे हो दोस्तों? A very good evening to all of you. Yesterday, in our last session, we were reading about cohort study in which we follow people in future. And that's why it is follow-up study, forward study. But there are two more type of cohort. One is retrospective cohort, where we follow people, but not in future. We follow their past by looking at any written record or any work history data, है ना? Any written record or work history data. Like, let me give you a very good example to understand it. Suppose from your batch, someone, let's say, Dr. No, I cannot take your name. Let's say Dr. Ashwani is someone, or Dr. Rahul is someone in your batch who studied very hard and took radiology branch. And now, after taking radiology branch, he is giving a big party. And his neighbor came and said to him, suppose the name of this neighbor is Majnu Bhai. तो मजनू भाई आया पार्टी में और बोला कि डोंट यू नो, बेस्ड ऑन 10-year वर्क रिकॉर्ड डेटा, है ना, बेस्ड ऑन वर्क रिकॉर्ड डेटा ऑफ लास्ट 10 year, दिस रेडियोलॉजी डिपार्टमेंट स्टाफ वेयर यू आर गोइंग टू टेक एडमिशन, मेरा पेन थोड़ा सा गड़बड़ा रहा है, तो चल जा भाई. ओके, तो इसकी थिकनेस नहीं बढ़ रही है. मैं मोटा हो गया हूँ, मेरा पेन पतला हो गया है. इसको मोटा करने में मैं कोशिश कर रहा हूँ, बट पेन नहीं मोटा हो रहा है. तो इसको कैसे मोटा करूं मैं? ऐसे तो मैं पहले कर लिया, आ गया. चलो, तो मजरू भाई आए आपके सक्सेस पार्टी में जब आपने रेडियो ब्रांच उठाया और बोला कि मेरे भाई, तू यहां पार्टी दे रहा है, क्या तेरे को ये बात नहीं पता है कि बेस्ड ऑन 10-year वर्क रिकॉर्ड डेटा, ओके, रेडियोलॉजी स्टाफ हैव 1.2 time more risk of testicular cancer. Okay, so मजनू भाई ने क्या बोला कि तेरे टेस्टिस खतरे में है, यू हैव मोर रिस्क ऑफ टेस्टिकुलर कैंसर, स्टिल यू आर गिविंग पार्टी इन आफ्टर गेटिंग रेडियोलॉजी. सो इन दिस स्टेटमेंट what is being done is they are comparing relative risk. They are comparing relative risk between two type of people. One people who are radiology staff, one people who are other department staff. And they are comparing that in the radiology staff and other department staff, if they have taken 10,000 people, both department, and suppose here in the radiology department 6 people develop testicular cancer, and in other department out of 10,000 5 people develop cancer. So if you compare 6 by 5, it will come 1.2. And based on this data, Dr. Majnu is saying that you have more risk of testicular cancer. Now tell me, is it a big risk? 6 case and 5 case, it's a very marginal big risk. And one more case in radiology department, maybe suppose in radiology department they have a khopcha, one corner, where after every MRI CT they are smoking or taking some alcohol or something like that. So one extra cancer can also be due to extra smoking. So it's not proved by radiology, that proved by this data that radiology department has very high risk. But all the newspaper people, they will publish this data as 20% more risk in radiology department staff. And they will try to scare us by saying 20% more risk. It's not 20% more risk. It's just one case more. So by this line, which Dr. Majnu is trying to say, what we are doing is we are comparing past history of two group of people. That's why we call it retrospective cohort, because we are going in past data, past written record of two group of people. And that's why it is known as historical cohort, because it's written data. So main thing you have to remember is whenever there is past written record or work history data without future follow up, just past written record, then it is retrospective cohort or historical cohort. Now the confusion here is we also read that in case control study we also go in past. So what is the difference between case control and retrospective cohort? Difference is in case control we take personal history. We don't use written record. We don't use work history data. That is why in case control study we can have recall bias. But in retrospective cohort we cannot have recall bias because we are not asking it from the memory. We are just using the data. Now what I was saying in English was कि retrospective cohort में हम लोग पीछे का work record history लेते हैं और केस कंट्रोल में भी पीछे जाते हैं. तो दोनों अलग क्यों है? क्योंकि रिट्रोस्पेक्टिव कोहॉर्ट में हम पर्सनल हिस्ट्री नहीं लेते हैं, केस कंट्रोल में पर्सनल हिस्ट्री लेते हैं. तो जब हम पर्सनल हिस्ट्री लेंगे तो हो सकता है कि जो लोग बीमार हैं वो पर्सनल हिस्ट्री अच्छे से याद रखें, जो ठीक हो चुके हैं वो भूल जाएं, जिसके चलते रिकॉल बायस होता है. अब यहां जब हम पर्सनल हिस्ट्री ले ही नहीं रहे हैं, रिटन डेटा कंपेयर कर रहे हैं, तो एक ग्रुप भूल जाएगा, एक ग्रुप याद रखेगा, इसका चांस नहीं है. और क्योंकि इसका चांस नहीं है इसलिए रिकॉल बायस रिट्रोस्पेक्टिव कोहॉर्ट में, हिस्टोरिकल कोहॉर्ट में नहीं हो सकता है. और यही दोनों में अंतर है. ओके, सो दैट वाज द थिंग आई वाज सेइंग इन हिंदी कि द मेन डिफरेंस इज केस कंट्रोल हैव पर्सनल हिस्ट्री, retrospective cohort has written data. That's why retrospective cohort has no recall bias because we are not taking personal history here. Okay. Then suppose Dr. Rahul, when Dr. Majnu said this thing, he said कि है ना जलता है मजनू, है ना, मजनू is just jealous because it's not big evidence, it's not big difference in data. So then suppose ignoring this advice of Dr. Majnu, Dr. Rahul took radiology branch. And after taking radiology branch, when he joined it for 3 years, he started doing a cohort study from there. So for 3 years, he did follow-up future, and he also used last 10-year data. Both future 3-year follow-up he did, and past 10-year data also he used. Then we will call such study as mixed cohort. Because now he is doing 3-year future follow-up and 10-year past record, both future plus past, so it is mixed. Okay, so what I am saying, let's write it down. The example, a good example which we can discuss here is that suppose along with using past 10-year work record history, okay, work record history data, 3-year future follow-up also done. And this 3-year future follow-up when done, it gave relative risk of 1.002 more testicular cancer in radiology department staff. Okay, cancer in radio department staff, radio staff. So the point here is that when future study was mixed with past data, then the relative risk came only around 1. 1.002 is roughly 1. And if relative risk is 1, it means there are 5 cancer out of 10,000 people in radiology department and 5 cancer among 10,000 people of other department. So if both have 5 cancer, then it will come 1. And if it is coming 1, it means there is no association. अगर रिलेटिव रिस्क 1 आ रहा है तो जितना कैंसर रेडियो में हो रहा है उतना कैंसर दूसरे डिपार्टमेंट में, और अगर दोनों में बराबर कैंसर हो रहा है तो इसका मतलब कैंसर का कोई रिलेशनशिप आप किस डिपार्टमेंट में काम कर रहे हैं इससे नहीं है. तो जब भी रिलेटिव रिस्क 1 हो जाता है, रिलेटिव रिस्क 1 का मतलब या ऑड्स रेशियो जब भी 1 हो जाता है तो उसका मतलब होता है नो एसोसिएशन, कोई एसोसिएशन नहीं है. Whenever, what I was saying is, whenever relative risk become 1 means the risk of cancer is same in radiology department as compared as other department. Both have 5 cancer. So if both have equal number of cancer, it means radiology department work is not related with cancer. There is no association. So do remember it. Whenever they become equal to 1, it is no association. And whenever relative risk or odds ratio is more than 1, like here it was coming 1.2. So if relative risk is more than 1 means there is positive association. We call it causative association also. Positive or causative association. Like yesterday we were discussing that there were 40 fight among alcoholic people, 10 fight among non-alcoholic. So 40 by 10 relative risk was coming 4. And if it is coming 4, it means more than 1. More than 1 means more alcohol, more chance of fight. That means alcohol is causing fight. Alcohol is positively associated with fight. Okay. So positive or causative association we say whenever relative risk or odds ratio is more than 1. And whenever relative risk or odds ratio is equal to 1, that is no association. So now let's understand this point that mixed cohort is also known by two other names, Ambispective cohort and nested case control. What does these three main name mean? First thing is, I think it is clear to all of you that in mixed cohort, we are going 3-year future follow-up plus past 10-year work record data both. So because both future and backward, that's why we call it mixed. That's why we call it ambispective. Ambispective means both direction. आगे भी पीछे भी दोनों तरफ है, इसलिए ambispective है, इसलिए mixed है. Okay, both direction. That's why it is ambispective and mixed, because cohort goes forward, case control go backward. Now the question is, why we call it nested case control? Tell me one thing. Doing which type of study is more difficult? 3-year future follow-up cohort is difficult, or using 10-year past data is difficult? Which one is more difficult? Which one is more difficult? See, 3-year future follow-up is tough. Past 10-year data is already in the computer. We just have to give one command and result will come. So past 10-year data can be collected in 1 day. 3-year future follow-up is tough. So main thing is cohort, in which we are inserting case control data. बात समझ रहे हो? 3 साल के कोहॉर्ट में असली मेहनत लगी है और उसमें हमने केस कंट्रोल का डेटा घुसा दिया है. तो क्या हो रहा है? कोहॉर्ट में केस कंट्रोल ने घोंसला बना लिया है. क्या बना लिया है? घोंसला, है ना. इसीलिए हम इसको कहते हैं नेस्टेड केस कंट्रोल. घोंसला किसने बनाया? केस कंट्रोल ने. इसलिए नेस्टेड केस कंट्रोल कहते हैं. लेकिन असल में ये स्टडी क्या है? असल में कोहॉर्ट है. कोहॉर्ट में पीछे का डेटा घुसाया है, केस कंट्रोल ने घोंसला बनाया है, इसलिए इसको नेस्टेड केस कंट्रोल कहते हैं, है ना. सो व्हाट आई वाज सेइंग इन हिंदी वाज कि मेन वर्क इज कोहॉर्ट एंड वी आर नेस्टिंग और इंसर्टिंग पास्ट डेटा. सो केस कंट्रोल हैज मेड ए नेस्ट. दैट्स व्हाई वी कॉल इट नेस्टेड केस कंट्रोल. बट वेयर दे हैव मेड ए नेस्ट? In future 3-year cohort, they had made a nest. So nested case control is not a case control. Nested case control is a cohort in which we are inserting the data of past, written data of past. Okay. So these two things are two other type of cohort. And there are two questions which I like to discuss here to make you understand this topic better. Let's do those two questions. But before doing those questions, let me tell you one thing, that when we do historical cohort or retrospective cohort, or when we do mixed cohort, ambispective cohort, or nested case control, in all these two study case, when we begin the study, at that time exposure is also present, outcome is also present. आपने इन दोनों एग्जाम्पल में देख के समझ गए होंगे कि जब हम स्टडी शुरू कर रहे हैं तो ऑलरेडी कुछ लोग रेडियोलॉजी डिपार्टमेंट में काम कर रहे थे पहले से, यानी एक्सपोजर और कारण पहले से ही प्रेजेंट था, और ऑलरेडी कुछ लोगों को कैंसर भी हो चुका था, यानी आउटकम जो परिणाम है वो भी पहले ही हो चुका था. तो जब भी हम रिट्रोस्पेक्टिव कोहॉर्ट या मिक्स्ड कोहॉर्ट की बात करेंगे तो एक्सपोजर आउटकम दोनों शुरू में ही प्रेजेंट होगा, है ना. और जब हम प्लेन कोहॉर्ट की बात करेंगे तो कोहॉर्ट कारण से शुरू होता है, परिणाम की ओर जाता है, एक्सपोजर प्रेजेंट होगा और आउटकम जो होगा कोहॉर्ट में एब्सेंट होगा. जैसे हमने एक बात करी थी, एक एग्जांपल लिया था कि कोहॉर्ट का कि दारू से लड़ाई, तो हम दारू की बात प्रेजेंट होगी, लड़ाई की बात हम फ्यूचर में जाके देखेंगे कितनी हुई. तो स्टार्टिंग में एक्सपोजर होता है, आउटकम नहीं होता है, हम उसको कहते हैं नॉर्मल कोहॉर्ट, या नॉर्मल कोहॉर्ट को ही हम कह सकते हैं प्रोस्पेक्टिव कोहॉर्ट, क्योंकि इसमें हम सिर्फ फ्यूचर में जाते हैं। लेकिन जब भी हम इन दोनों स्टडी की बात करते हैं जिसमें मिक्स्ड है या पीछे जाना है, रिट्रोस्पेक्टिव कोहॉर्ट, तो शुरुआत में ही दोनों चीजें प्रेजेंट होती हैं. व्हाट आई वाज सेइंग इन हिंदी वाज, when we go in cohort we only go in future direction, so we know the reason exposure but we don't know the outcome. Like we know that alcohol is causing fight, but we are starting with alcohol, not with fight we will observe in future. But whenever we talk about these two things, historical or mixed, we already know that some people are working in radiology department, so exposure is also present, and we already know some people had developed cancer, so outcome was also present at the beginning. Both things present at the beginning in these two study, but outcome is absent in starting of prospective cohort. I think it is clear now. How to remember these name? To remember this name, this mnemonic which I have written there, Rh positive man can be used. We all know that erythroblastosis fetalis, ABO incompatibility occur when who should be positive, who should be negative. Male should be positive, female should be negative, then only problem occur. So how we can use this as mnemonic? R and H stand for retrospective historical, where we use past written record. And you know man can go in any direction, so man for mixed, ambispective, nested. So by this mnemonic you can remember this 5 name very well. Rh positive man. And when I was in MBBS I used to think that Rh negative people are only 4-5%. So how rare it will be that I will marry someone who is Rh negative. So I used to ignore this topic thinking just for exam it is needed. But then it actually happened. My blood group was A positive and my wife blood group was O negative. And this Rh incompatibility problem occurred in our first childbirth. Prisha Lakshmi, my child who is now 3.5 years, her birth at that time, because of this Rh incompatibility, which type of test we do in the mother? Do we do direct Coombs test or indirect Coombs test? Remember, direct Coombs test is done for direct Coombs test is done for when there is RBC damages due to some autoimmune reason. Autoimmune hemolytic anemia have direct Coombs test. Indirect Coombs test we do for Rh positive negative incompatibility. So at 28 week of gestation, I hope you know or you will be knowing in gynae at that time, at 28 week we give anti-D to the mother so that the antibodies are not formed against the child. So at 28 week, the gynae in the Max hospital where my wife was going for delivery, she gave that injection. And at 34 week, she asked my wife to go through indirect Coombs test. After going through indirect Coombs test, result came positive. And the titer was 1:2. So as soon as result came positive, the head of the gynae there, doctor, I should not take the name, but she said ki now the result has came positive, you should induce delivery today at 34 week. Then my wife said ki ma'am, you had given us anti-D injection at 28 week. So because you gave us antibody, of course after 6 months some antibody will be in my blood, so you are detecting that only. It's not a chance that incompatibility has happened. It's not an emergency thing. And I said ki ma'am, let's check the titer first before deciding should we induce abortion, induce labor today or not, because if the labor is induced at 34 week, it can lead to preterm delivery. So then the gynae head over there, she said ki no, once it has come positive, it will only increase in future. You cannot risk your future child future. So induce delivery today. We said no ma'am, we will not induce it without looking at the titer. She said you are going against doctor advice. I said ma'am, it's quite obvious. I am not following your advice. And she write it down that thing. And she was not aware that we are a doctor and we are aware of this thing. So she write it down that patient not following doctor advice, go and all. And then when we checked the titer, it came 1:2. So at which titer we should induce delivery if there is RH incompatibility case? Titer should be around 1:16 or more than that. Then we can induce delivery labor at 34 week. But if titer is 1:4, 1:2, it's not suggestive of any incompatibility. It's suggestive of this anti-D thing only. So we waited for 1 week, and then the titer actually came negative. And then we went back to that gynae ma'am and said, see ma'am. And she said, yes, I just confirmed it from the lab. Yeah, you were right. We should check for titer. मेरा मन क्या पूछूं कि बुढ़िया क्या कबर में ले जाएगी पैसे, क्या करेगी इतने पैसे का? I was about to ask you, what will you do with all this black money if you are inducing delivery without proper indication? What will you do with earning all these things? So, but then of course I had to wait for the delivery, and after delivery, such sweet girl child came, so I forgot all those things. But this is my revenge by telling this is the thing which can occur with you also, and that in future deliveries, this is one common mistake which you or your relative might do. That incompatibility thing, titer for anti-D can come positive, but it, without looking at the titer, you just by positive result, you should not induce labor. Okay. So I hope this story will help you in remembering this mnemonic much better. RH positive man is the problem. I should not be A positive. And that was the issue of incompatibility. And of course, the name will be clear. R and H, retrospective historical, man mean mixed, ambispective, and nested case control. So this is the 3 type of cohort study. Let's do some question based on this 2 type of cohort study. Then we will come back to discuss other topic. But first, let's do this question. Let me see where is the question of this topic. Tidding, 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 tidding. Let me search for the question. Yes. Yeah, it will come. It will come. Yes. Yes, this is the question. So among 10,000 mother, a questionnaire asking about smoking and other habits, other habits were distributed, and after 6 months of follow-up, data was compared about low birth weight in smoker and non-smoker mother utilizing written data of questionnaire. So it represent which study? हो क्या रहा है कि हम 10,000 माओं से पूछ रहे हैं कि क्या तुम सुट्टा पीती हो, क्या तुम दारू पीती हो, तुम एक्सरसाइज क्यों नहीं करती हो, ये सारे सवाल क्वेश्चनर में पूछ रहे हैं. वी आर आस्किंग क्वेश्चनर ऑफ स्मोकिंग अल्कोहल फ्रॉम 10,000 प्रेग्नेंट मदर. आफ्टर आस्किंग दिस, कलेक्टिंग दिस डेटा, we are doing 6-month follow-up, and then we are also utilizing the starting data of questionnaire along with 6-month future follow-up. We are utilizing the data of questionnaire. So now which type of study is done here? Is it retrospective, nested case control, cohort or case control? Please do let me know. मेरा है क्या उसमें? YouTube जरा दिखाना. देखिए bro. हाँ, कोई भी उस पे ही दिखा दो. हाँ. चलो. So what is the answer? So to find answer of such question, one thing is you have to look at the keywords which are there. Like they have used the word follow up. Follow up is done. And when you are doing follow up simply means it cannot be case control. It cannot be retrospective cohort. Because in retrospective cohort and case control, in these two, we don't do follow up. In case control, we take personal history. Retrospective cohort, we use written data. But we never do follow up in these two. So these two options are gone. Retrospective gone, case control gone. Now, we are also utilizing written data. So because written data is utilized along with follow-up, both the work is done. Future follow-up, past written data. So we call it nested case control. If they are doing only follow-up, then it will become cohort. Okay. So I hope this question is clear to all of you. And most of you gave the answer, nested case control. Very good. Sumaya, Dr. Manisha, Lion, Anant Krishnan, Soumya Deep Sarkar, Mirja, one more new friend, Adav Raju Avinash. My pet name, sorry, my house name is Raju also. So hi Raju. and all these things are there. So I hope this kind is clear to all of you. Very good. Now, so this question is clear. Let's have one more question on this topic. One question I want to give you is that, okay, scrotal cancer. Don't say why I talk about testis, scrotum, all the thing. It's based on my experience of 3 months of sex and marriage counseling OPD. And in AIMS PSM, they make us to sit in sex and marriage counseling OPD. And I'm a trained sexologist and marriage counselor. And I found out that most of the issue with sex and marriages is because we don't talk about sex. We think it is so big enigma. And if doctor will hesitate in talking about it, how will we find the correct thing? And so we should be free. And this is a real thing which is written in Park, that scrotal cancer is 9 times more common among chimney wiper of coal tar factory. People who wipe chimney of coal tar factory, they have it more 9 times more as compared to clerks, as compared to staff who are not wiping the chimney. And this is based on 20-year work record data. So this time, if it is based on 20-year work record data, that it is 9 times more common scrotal cancer among chimney viper as compared to other staff, which type of study will it be? Will it be a retrospective cohort? Will it be a prospective cohort? Will it be a mixed cohort? Or will it be a case control? What is the answer? So I hope all of you will give the answer very clearly. Mukund Gupta already did. It is retrospective cohort. Why? Because here we are not doing follow up of future. We are only using 20-year work record data. So because we are using only 20-year work record data, it is retrospective cohort which is done here. And why it is not case control? Because it's not that one group, we are not asking personal history from them. We are using work record data, so it cannot be case control. Okay. And because there is no future follow up. So if future follow up is not there, prospective cohort and mixed cohort, both options are gone, because in both of them we do future follow up for sure. So yes, all of you are right. It is retrospective. Sumaiya, Dr. Lion, Dr. Saudip Sarkar is also correct, and he write the other name also, historical cohort. We can also say retrospective as historical. Okay, so I think with this 2 question and 2 example, this topic must be crystal clear to all of you. Now we have done the topic of cohort, case control, and 3 type of cohort and their names also, but let's do some interesting question based on that. Okay, so first let's do this point, that if you are getting relative risk of heart attack 0.85 among green tea drinker compared to non-green tea drinker, it represent which type of association? Causative association, no association, or protective or negative association? Which type of association will you call it? So here relative risk is coming less than 1, or odds ratio is coming less than 1. And if it is less than 1, less than 1 is known as protective or negative association. As I said, relative risk equal to 1 means no association. Relative risk greater than 1 is positive or causative, but less than 1 is negative or protective. Let me further ask an interesting USMLE question on this topic. The question was this, that if relative risk is coming 0.85, what does it mean out of the 4? So it's a tricky question. Let's see whether you can understand the trick or not. What does it mean? If relative risk is coming 0.85, what does it mean? What is happening here? If relative risk is coming 0.85, 0.85 means 85 by 100. It means if we took 10,000 people who drink green tea. So first we are talking heart attack in people who drink green tea drinker. Okay. and then we are comparing it with other 10,000 people who have heart attack, but they don't drink green tea. Okay. So we have two group of 10,000 people, all more than 80 year. In the first group of 10,000 who are drinking green tea, 85 heart attack occur. In the second group, 100 heart attack occur. So if this thing happened, relative risk will come 0.85. And if relative risk is coming 0.85, what does it mean out of A, B, C, D? Dr. Mirza has answered A 2 times. Blessy Saron A, Adav Raju Avinash A, Mukund Gupta A, Swadip Sarkar A. Everyone is answering A for this answer. And I am surprised and amazed because usually people, some of you should give answer wrong. All of you are correct here. Very good. It is 15% less risk because 85 is not 85% less than 100. 85 is 15% less than 100. So first thing is that relative risk is coming less than 1. If it comes less than 1 means negative association. You drink more green tea, heart attack will be less. ज्यादा हरी हरी चाय पीने से मायरे माई एमआई नहीं होगा, कम होगा, है ना. एमआई will be less. So protective means less risk. So these two option of more risk, they can never be correct because it is less risk. Now how much less risk? Of course, how much less is 85 from 100? 15% less. So if in any exam or any question they gave relative risk equal to 0.6, what does 0.6 means? Does 0.6 means 60% less or 0.6 means 40% less? I hope you could answer it. 0.6 रिलेटिव रिस्क का क्या मतलब है? 60% कम रिस्क या 40% कम रिस्क? देखो 0.6 का मतलब होगा 60/100 और 60 100 से कितना कम है? 40 कम है. तो जब भी 0.6 की बात करेंगे तो उसको हमें जो भी पॉइंट में होता है उसको 1 से माइनस करके तब आंसर आता है. 0.6 है तो 40% लेस रिस्क, 0.7 होता तो 30% लेस रिस्क, है ना. What I was saying in Hindi was 0.6 means 60/100, and of course 60 is how much less than 100? 40% less than 100. So whenever we say less than 1, we will first subtract it from 1, then whatever will come will the answer. Like 0.85 we will subtract from 1, 15% less risk. 0.6 subtract from 1, 40% less risk. Okay, so I hope this is clear. This type of association is negative or protective. Now let's do a very interesting question. This question, when it came now, one of a really good teacher gave wrong answer to this question. But I hope if you are Sherlock Holmes lover and all, you will be able to answer it correctly. It's a challenge for you. The question is that they did two study. First study have relative risk of 0.5. Second study have relative risk of 2. So if it is 0.5 and 2, out of the 4, which graph correctly represent it? Okay, in first option, here they have written relative risk of 0. Here relative risk of 1. Here they have written relative risk of 0. And here they have written 1. So which graph out of A, B, C, D correctly depict them? Correctly tell about their correct representation. Okay. Dr. Somdeep Sarkar, Mukund Gupta, Lion Mirza, Soumya, Anand Krishna, all are replying one answer. What is that answer? See, there are two simple things which can help us in deciding the answer. First is that 0.5 is negative association and 2 is positive association. So negative and positive association should have opposite direction, na? So either A is correct or B is correct. They cannot be in the same direction. First thing. Second thing, relative risk, if it is written 0, below 0, there should be minus 0.5, na? We cannot write 0.5 below it. So this is mathematically wrong, option A. And if you look at option D, if it is written relative risk 1 here, More than 1 will be 1.5 now. We cannot write 0.5 above 1. So this is also mathematically wrong. So now only correct answer is B. Why B is correct answer? Two logic. First logic, relative risk can never become 0. Either it will be 1 or less than 1 or more than 1, but it is never 0. So when it is coming 1, only in option B and D it is coming 1. So relative risk 1 means no association. That's why cutoff should be 1. Second point is 0.5 is negative association, 2 is positive association. So only B plot is representing it correctly, and all of you have answered it correctly. Very good. It is B. So either it was not tricky for you or you are very intelligent. So either you understood it well or you are very intelligent. That too can be the reason. I hope both are the reason. So let's do now a second type of question from this topic. I think this topic is clear to you. Less than 1, more than 1, and this thing is clear. Now let's come to this question. There was one student in the group whose name is not today. Not today. Okay, tomorrow. Let's do this question. Question is, in a study they found alcohol addiction is causing more divorce rate. So then they took two group of participant who are divorced and participant who are without divorce. And in both group, they ask, how many days in a week do you use to drink alcohol? Okay. Because addiction, some amount is in everyone. They want to compare who will have an excess addiction. Problem is when alcohol addiction become excess. This excess alcohol addiction is the reason, exposure. And divorce is the outcome. सो कहानी शुरू हो रही है ज्यादा दारू पीने से, खत्म हो रही है डाइवोर्स पे. ऐसा भी हो सकता था कि कोई डाइवोर्स के बाद बेवड़ा हो जाए, लेकिन यहां बात वो नहीं है. बात क्या है? Here we are not talking that divorce is causing the person to become addictive. Here the story starts with excess alcohol addiction, end with depression. And there are two groups in the study. You can see what are the two groups. So which study is done here? Is it a case control, cross-sectional, cohort, ecological? Which type of a study is done in this example? What is the answer? Okay, many of you have already given the answer. So I'm surprised with your quickness to reply. Yeah. Here, the two group are participant divorced and participant without divorce. That means that one group is the one where outcome is present, other group is the one where outcome is absent. So if outcome present absent is the two group, we call such study as case control. If two group are excess alcohol addiction present and absent, exposure present absent, we call it cohort. है कि नहीं? अगर होगा कि दारू कम पी रहे हैं, दारू ज्यादा पी रहे हैं और उनको फ्यूचर में जाके देखेंगे तो कोहॉर्ट हो जाएगा, क्योंकि दारू कारण है. लेकिन अगर दो ग्रुप है, डाइवोर्स है नहीं है, तो आउटकम प्रेजेंट एब्सेंट है, जो परिणाम है, और परिणाम है नहीं अगर शुरू का दो ग्रुप है, तो उसको हम केस कंट्रोल कहते हैं, है ना. इफ द टू ग्रुप एट द बिगिनिंग इज आउटकम प्रेजेंट एब्सेंट लाइक डाइवोर्स प्रेजेंट एब्सेंट, इट इज केस कंट्रोल. But if in the same question I made the two group excess alcohol addiction present absent, it will become cohort. So I'm very happy to see your response. It is case control, and all of you have correctly identified it. What we are doing here, we are starting with one group who have divorce, one group who have no divorce, and we ask the past history of addiction. So one is saying with divorce that usually 5 days a week they used to have alcohol, and here 2 days a week have to have alcohol. So less addiction, less divorce, more addiction, more divorce. Like that came from, of course, from taking past history. So that's why, because divorce, no divorce is the two group, it is case control. Okay. And if the couple is drinking together, then chance of divorce is less. But if one is drinking, one is not drinking, then there is the imbalance which can cause divorce, I think. Anyway, come here. Let's take one more example and understand this topic better. they can create such big question, but don't be scared with the length. Just try to correlate the character of the story again like previously you did and try to answer it yourself. What is the question? The question they are saying is कि ज्यादा स्टेरॉयड लेने से ज्यादा डायबिटीज हो सकता है. अब एक गांव में स्टडी करी गई कि जो लोग झोला छाप डॉक्टरों से इलाज ले रहे थे, जो देते हैं एक्सेस स्टेरॉयड, जो ज्यादा स्टेरॉयड देते हैं. कौन ज्यादा स्टेरॉयड देते हैं? झोला छाप डॉक्टर और गांव के फार्मा वाले लोग, फार्मा शॉप वाले लोग ज्यादातर क्या करते हैं कि हर बुखार में, बदन दर्द में एक छोटी सी स्टेरॉयड की गोली डाल देते हैं. तो मरीज को लगता है जादू हो गया, 1-2 दिन में उसका बुखार, दर्द सब गायब हो जाता है, बहुत दुआएं देता है. लेकिन स्टेरॉयड के 5-6 मेजर साइड इफेक्ट हैं, जिसमें से एक मेजर साइड इफेक्ट है डायबिटीज, वो हो जा रहा है. अब एक स्टडी की गई जिसमें हमने 2 ग्रुप बनाया. एक ग्रुप वो हैं जिनको एक्सेस स्टेरॉयड मिला है और दूसरे वो ग्रुप हैं जो पीएचसी से इलाज ले रहे हैं. दोनों को हमने कंपेयर किया कि भाई किसमें डायबिटीज ज्यादा होगी. तो यहां कौन सी स्टडी हो रही है? क्या ये केस कंट्रोल है? क्या ये कोहॉर्ट है? क्या लगता है आपको? व्हाट आई वाज सेइंग इन हिंदी वाज, ऑफ कोर्स यू कैन अंडरस्टैंड इट. वी आर comparing 2 groups of people. One group who are given excess steroid, one group who are taking treatment from PHC. And we are trying to know which group has more diabetes. So which study is done here? Here this time, most of you answer cohort and you are saying, sir, you are high or what? You should write B here, C here, not A, C, B, D. But anyway, you are replying cohort, that's why. And all of you, let me tell you whether you are right or wrong. How to decide such question, such thing? You have to look which is the starting point of the story, what is the exposure. आपको पहले देखना है कि कारण क्या है. If you identify what is the exposure or the reason, risk factor, and that is the 2 group present absent, it will become cohort. But if the 2 group is outcome, diabetes present absent, it will become case control. So I have not written anywhere diabetes present absent as the 2 group. The 2 group which we have written is one group getting excess steroid from quack, one group getting less steroid. So exposure or reason is present absent. That's why it is cohort study, and all of you are correct again. Very good. Okay. So definitely correct. This is cohort. How to do such type of question? You have to see whether there is one group or 2 group. Okay. If there is 2 group, then we have to see is the 2 group is exposure present absent or outcome present absent. If outcome present absent is the 2 group, it become case control. If exposure present absent is the 2 group, it become cohort. So what are the 2 groups in the story? That you have to see, and the answer will be simple. Okay, chalo, let's do some more question. Okay, this question has been done. This I practiced. So let's have some more question. I must be having some more question for sure. Yeah. This one I will come and discuss. Let's discuss this 2 question. First, let's discuss this question. Question is, you can see yourself. This time I am not going to decode it in any language. Just you find the answer and tell me what is the answer. Options are: option A, is it cohort? B, is it case control? C, is it cross-sectional? D, is it historical cohort? What is the answer? पोल करा देते तो बेस्ट होता. Okay, I will learn how to conduct poll, and next time I will try to do that. So again, how you have to decide? First, you have to check whether there is one group or 2 group. So there is 2 group in the study. one group is having depression, one group is without depression. And now you have to check what is the exposure, what is the outcome. Depression is outcome or exposure? Depression is the disease, is the outcome. And if outcome present absent is the two group, disease present absent is the two group, परिणाम है या नहीं है, outcome है या नहीं है, disease है या नहीं है, if this is the two group, then it is case control and you all are right. If the two group is excess use of social media present absent as the two group, then this is the starting point of the story. This is the reason, cause, risk factor, exposure, and exposure present absent is the two group, then the answer will be cohort. Okay, so here what we are doing, one group of student are those with depression, one group are student are without depression, and we are asking them past history of social media use. So let's say depressed student are saying that we are using it for more than or equal to 7 hours per day, and no depression are saying we are using it 1 hour per day approximately or 2 hours per day. So based on this thing, we are comparing that group, and the starting point is case with depression, control without depression. That is the two groups. So answer is case control. So very good. You have found it. Now let's do some more question. Let's do this one question. This is one question which will challenge you in a good way. The question is, suppose you are working as a medical officer in charge in a village. And because this actually happened with me when I was in Dayalpur posting. A young man came to me and said, Ki, sir, in our village, a lot of cancer cases are occurring, and we think that the nearby chemical factory is releasing the pollutant in our water that is causing the cancer. So kindly do a study, prove that the cancer is due to factory so that we can prevent factory from dumping their pollution in our village water. So that young man requested it from me. I said, man, my guide is constantly abusing me for not finishing my own thesis work. How will I be able to do your extra study work? So I did not did that study actually. But suppose you are trying to do that study. Which group you will take as control? Who will be taken as control in your case control study? Okay. Is it the people from the village with ALL? Is it the mixed population of children from nearby OPD? Is it all non-exposed children of city without ALL? Or is it all exposed children of village without ALL? Which will you take as control in your case control study? Now your answer is differing. Anant Krishnan is saying A, Sumaya is saying B, then Sumaya changed it to D, then not today is saying A, Himanshu Ranjan is saying B, A, B. You are confused this time. Okay, good. Because when you are confused, you focus more and you remember it for your main exam. So try to give wrong answer, but keep answering. First thing is, they are control. Who are with disease? Case are disease. Control are always without disease. So because control are without disease, they should be without ALL from nearby OPD without ALL. Sorry, I should have written it earlier in the beginning. It is missing. It should be there in the question C also. But if you look at option D has written with ALL. This cannot be correct. We cannot choose the people with disease as control. They will become case. So option D can never be correct. And without ALL is written in option C, A, B, all these three. In the original question, it was written. Sorry, I should have typed it earlier, but it was my mistake, my typing error. Kindly forgive. So without ALL is both in all in A, B, C, but not in D. It is with ALL. With ALL is only case. बीमार होंगे ना, केस होंगे ना. अगर बीमारी है तो केस हो गए. कंट्रोल में तो नहीं होगी बीमारी. तो आंसर ए बी सी में से क्या है आप सोच के बताओ. क्या है? देखो, if in the beginning of the study we already know that control are all exposed, 100% exposure is already there. what we will ask in past history. And if at the beginning we know all are non-exposed, again what we will ask in past history? We ask past history and then compare that how many percentage are exposed, how many are non-exposed. This is something which we cannot know at the beginning. At the beginning, we have to start with a mixed population. And then by taking past history, we will confirm that which group will have more cancer, village water drinking group or other water drinking group. Let me explain what I am saying. We cannot start with knowing exposure. In a case control study, when we start case control, at the beginning of case control, outcome is present. Cancer has happened. But exposure is something about which we don't know. Exposure is absent. This is the definition of case control study. मैं ये कह रहा हूं कि केस कंट्रोल में शुरू में बस ये पता होता है कि बीमारी है, बीमारी नहीं है. हमें बीमारी का कारण पूछ के पता लगाना होता है. शुरू में हमें कारण है या नहीं है, ये नहीं पता होता है. तो अगर मैंने शुरू में ही लिख दिया कि सारे बच्चे एक्सपोज्ड होंगे, सारे बच्चे नॉन एक्सपोज्ड होंगे, तभी कंट्रोल लेंगे, तो पूछने के लिए बाकी क्या रह गया? एक्सपोजर हमें शुरुआत में पता नहीं होना चाहिए. तो जिन जिन क्वेश्चन में एक्सपोजर पता है शुरुआत में, वो आंसर नहीं हो सकते हैं. शुरू में हम मिक्स्ड पॉपुलेशन लेंगे, हिस्ट्री लेके कंफर्म करेंगे कि किसमें कैंसर ज्यादा हो रहा है. व्हाट आई वाज सेइंग इन हिंदी वाज एट द बिगिनिंग एक्सपोजर शुड बी एब्सेंट. So we cannot start with one group where exposure is all present, one group where it is all absent. We have to ask it from history and then compare. So only correct answer will be C. Let me explain it theoretically with proper diagram to make it more clear to you. This is one group where ALL is present. This is one group where ALL is absent. This ALL absent without ALL is our control. Now we will take the past history from this two group. Past history that where you used to drink water from. आप पानी कहां से पीते थे? So in the ALL present group, if there are 100 children, out of them 80 suppose said we were drinking village water, and 20 said we were drinking water from other source, not village water. Or when we ask the same thing from ALL absent, in this group 10 said we were drinking village water, 90 said we were drinking other source. So based on this difference, we can tell that ALL is more in those people where 80% are drinking village water, and ALL was less in those people where 90 people are drinking other source. So it looks like village water is causing ALL. So the answer always come in 80-20, 90-10, some percentage. In the beginning, I cannot say that all the people where ALL is absent, 0 are drinking village water. We cannot say it in the beginning. We will ask the history, only then we can say that 0 were drinking village water. We cannot start with all 100 drinking village water or 0 drinking village water. This we cannot know at the beginning. जब शुरुआत होगी तो हमें ये नहीं पता होगा कि कितने लोग जिनको कैंसर नहीं है वो गांव का पानी पी रहे हैं, कितने नहीं पी रहे हैं. शुरुआत में हमें ये नहीं पता होता है. हम पूछ के पता लगाते हैं और आंसर हमेशा कुछ परसेंटेज में आएगा, है ना. वो शुरू में ही अगर हमें पता चल जाए कि सारे लोग गांव का पानी पी रहे हैं या सारे लोग नहीं पी रहे हैं, तो पूछने के लिए बाकी क्या रह जाएगा? फिर कुछ केस कंट्रोल स्टडी बनेगी ही नहीं. समझ में आया? If at the beginning we know that all 100 are drinking village water or 0 are drinking village water in the control group, then what is left to ask? Everything is already known. How can we conduct such a study? So in the beginning, we cannot know all exposed, all non-exposed. In the beginning, we have to start with mixed population who are without ALL. Okay? Yes. So I hope this is confirmed. See, I hope it is clear to all of you. Yes. Now let's do one more question. ऑनलाइन फूड ऑर्डरिंग, ऑनलाइन खाना ऑर्डर करने से ओबेसिटी यानी मोटापा हो सकता है. तो अगर हम लोग कर रहे हैं कोहॉर्ट स्टडी, तो कोहॉर्ट स्टडी में 2 ग्रुप कौन से होंगे? इफ आई एम डूइंग ए कोहॉर्ट स्टडी, what will be the two group? Obesity present absent, online ordering present absent. Tell me, A will be cohort study 2 group or B will be cohort study 2 group? Tell me. Yes, very good. All of you are again correct. Anand Krishnan, Mukund Gupta, Sumaya, Matthew, George, a new friend in our gang. Not today, Manisha. Welcome. All of you are correct because cohort start with exposure present absent. And here exposure is online food ordering. So exposure present absent online food ordering will be two group for cohort. But when they ask in the real exam, they ask what will be the two group for case control. So for case control, what will be the two group? Obesity present absent. That will be the two group for case control because obesity is the outcome. And if the two group is outcome present absent, we call it case control. This is quite clear. I hope this case control cohort and how to differentiate between them is very clear to all of you. And retrospective mixed cohort is also clear. On the day when we were discussing cross-sectional ecological in our first class, this is my third class in your batch, luckily. So in the first day, we have discussed some question on cross-sectional ecological also. But let's, if you want, we can have some more example from cross-sectional ecological also. Okay. But let's have this one last topic area, which we also should know from this point. The one thing which we should know is, if they ask what is the best indicator of strength of association, what do you mean by this thing? Strength of association. Strength of association means how strongly two things are related. If you want to know that thing, which we should use? Odds ratio, relative risk, population attributable risk, attributable risk. See, whenever odds ratio, relative risk we talk, this is something which clinician use. People sitting in OPD, they like to talk directly. So they use odds ratio, relative risk because it talks directly. है ना, मान लो आप सुट्टा पी के सीनियर की ओपीडी में चले गए तो सुट्टा स्मेल कर लेगा क्योंकि अपने टाइम में वो भी फूकता था और स्मेल करके क्या बोलेगा, सुट्टा मत फूक भाई, सुट्टा फूकने से कैंसर के चांसेस 10 गुना ज्यादा है. तो उसने क्या कहा, 10 गुना, 10 टाइम. और जब भी 10 टाइम यूज होता है तो क्या यूज कर रहे हैं हम लोग? ऑड्स रेशियो रिलेटिव रिस्क में हम लोग यूज करते हैं टाइम, 10 टाइम. तो ये देखो सीधी सीधी बात बताया, सुट्टा से 10 गुना ज्यादा. और सीधी बात करना क्लिनिशियन को पसंद होता है, इसलिए ये दोनों क्लिनिशियन यूज करते हैं. और टेढ़ी बात करना किनको पसंद होता है? सरकार को और पब्लिक हेल्थ एक्सपर्ट को, एपिडेमियोलॉजी को, एपिडेमियोलॉजिस्ट को. इसलिए पब्लिक हेल्थ एक्सपर्ट जब हम लोग बात करते हैं, सरकार बात करती है, तो वो बात करना चाहती है पॉपुलेशन एट्रीब्यूटेबल रिस्क या एट्रीब्यूटेबल रिस्क में, है ना. व्हाट आई वाज सेइंग इन हिंदी वाज कि let's say you went to a senior after smoking cigarette, your senior will smell it because at his time he also used to smoke, and he will say don't smoke, smoking increases the risk of cancer 10 times. So he is using the word 10 time. Time word is used in odds ratio relative risk, and he is trying to tell the thing directly to you. So clinician use this too because they talk about the association directly. Okay, but these two things are talking about association indirectly, and that is why government and public health expert like to use these two things. So which one is best indicator of strength of association? The correct answer is relative risk, because relative risk talks directly. So now you can say, sir, why not odds ratio? Because odds ratio, remember, we found in case control study. और केस कंट्रोल स्टडी में हम सब पूछी पुछाई पीछे की बातों पे भरोसा करते हैं, और पीछे की बातों में भरोसा करने में दिक्कत क्या है कि कुछ लोग भूल जाएंगे, रिकॉल बायस हो जाएगा. इसीलिए हम लोग केस कंट्रोल को कभी भी इंपॉर्टेंस नहीं देते हैं. ऑड्स रेशियो को रिलेटिव रिस्क के सामने घंटा कोई वैल्यू नहीं देते. तो ज्यादा बेटर कौन है? रिलेटिव रिस्क, है ना. व्हाट आई वाज सेइंग वाज कि इन केस कंट्रोल द मेजर प्रॉब्लम इज रिकॉल बायस, बिकॉज इट ऑल बेस्ड ऑन योर रिकॉल ऑफ पास्ट exposure. So based on recall, if you are doing something, you can do mistakes. Recall bias is a big bias. That's why odds ratio which come from case control study is not given much importance. More stronger will be relative risk. Okay, And these two things, PAR and AR, they are used by public health expert. But which one is better? Which one is better? Population attributable risk is better, or attributable risk is better? If you want to give some information to people, PAR is better than AR. Why PAR is better than AR in giving information? Because PAR talks in a positive way, AR talks in a negative way, and people don't like to listen to negative thing. They take it from this ear, ignore it. That's why PAR is a better way to give information to public. Let me explain with example. Suppose you want to see me as a slim person. You don't want, but suppose. So you can tell it to me in two ways. First, कि मोटे दौड़ नहीं तो फटेगा, है ना? If you will not run, risk of diabetes or hypertension due to not doing exercise will be 60% or 70%. This is negative way, attributable risk. Second thing you can say is कि अगर मोटे तो दौड़ेगा ना तो 5 साल जवान दिखेगा, है ना? If you will run, you will look 5 years younger. Risk of BP or sugar will decrease by 60%. So which advice I will like to listen? Second one, because it is talking in a positive way. Okay, that's why always this PAR is better. Okay, but what government write on cigarette packet? Tell me this answer. This is on the cigarette packet. It is written, smoking causes lung cancer. So if this is written, smoking causes lung cancer, what they are using here? Are they using attributable risk or population attributable risk? On the cigarette packet, what they are using? AR or PAR? Now, PAR is a better way. Very good, correct, Anant Krishnan. But if it is written, smoking causes lung cancer, dhumpan kark rog aahe, hai na? So then which thing they are using? PAR or AR? Or RR? What they are using? Very good, Mukund Gupta, Matthew George, you both were right on this, see this thing. When they say smoking causes lung cancer, they are trying to say that lung cancer is due to smoking. So causes means due to, lung cancer due to smoking. So they are using the word attributable risk. And that's why no one is giving importance to that warning. They are thinking that my father used to smoke 30 years, my uncle used to smoke 60 years. They did not develop cancer. I will also not develop it. We ignore negative thing from there. But suppose on the cigarette packet, they start writing that by decreasing cigarette every day or by decreasing cigarette by 20%, your stamina will increase by 10%. Or chances of cancer will decrease by this much if you decrease cigarette, if people stop smoking cigarette. And then this is positive way of telling people they would like to listen it more and try to decrease it more. Okay, so better government should use PAR, but they use AR, which is wrong. Okay, because PAR is a positive way, and that will create better impact. That people like to listen the thing. Okay, chalo. So Dr. Sutapa, I already noticed your request. Let's practice some more question on this topic. How to decide which type of study we have to apply. Okay. So let's do some more question. Suppose the question is like this, that old age is associated with depression. Have I done this question? Have I done this question on the first day? Let me know. Old age is associated with depression. Have I done this question or not on the first day of the session? Old age is associated with depression. In a study, villagers are asked. What we are asking villager? Villagers are asked about presence or absence of depression in their present life. Presence or absence of depression in their present life. Okay. What we are asking from villagers? कि चचा उदासी लग रही है कि ना लग रही है, जिंदगी कैसी लग रही है, खुशहाल कि दुखहाल, Now we are asking from everyone, are you depressed or not depressed? What is your age? So if I am asking this question from all the villagers, which type of study it is indicating? Option A, is it cohort? Option B, is it cross-sectional? Option C, is it ecological? Or option D, is it case control? Which type of study does it represent? है ना? So try to give the answer. Chalo. So my dear friend, some classes when I take this question, they say that, sir, we can see two group here. One is presence of depression, one is absence of depression. And depression is the outcome, old age is the exposure. So because the two group is outcome present absent, answer will be case control. But they are wrong. Depression present absent is not two group, it is two response. Like on the first day I ask this question, do you use Tinder or Bumble or some other dating app? What is that? Happen and all of that. Hai na? So when I ask, do you use it? It means you will reply presence or absence of Tinder on your phone. Hai na? Then I ask the second question, do you have gastritis or not? So there is not two group, it's two response, either presence of gastritis or absence of gastritis. So presence or absence is two response, not two group. So there is only one group of participant here, villager. First hint. Because there is not two group, it cannot be case control cohort. Both are gone. There is only one group of villager. Second hint given was, I am asking presence or absence of depression in their present life. I am not talking past history, what happened. I am not talking about future follow-up. Present life. And which study focus in present life? Cross-sectional. That is why the other name of cross-sectional is snapshot study. Because can you take picture of future or past? No, I can only take picture of right now, present moment I can take picture. And suppose this is the live class, not this is the live class. Suppose it is face-to-face class. You are sitting in front of me. I will take your picture. And by taking your picture, I can count how many of you are wearing glasses. So I can know the prevalence of refractive error in the class. So which study will help us knowing the prevalence? Cross-sectional. It will help us count that 10 out of 100 have refractive error issue. 10 out of 100. So that is snapshot prevalence study, cross-sectional study. Answer is cross-sectional. Have I done this question already? Or is it first time I was giving this question? Do tell me. Have I told it already, or this is something which is a new example? Okay. So I think this is clear. A snapshot of the condition, and correct answer is cross-sectional. This is clear. Now, Anant Krishnan is asking me, can you explain uses of AR and PAR again? Uses only. Okay. Yes, my dear friend, I have this written also somewhere. Let me go to that slide. Everything which I usually write is written somewhere else also. It's here. Dekho. When we talk about strength of association, how strongly two things are related, it is relative risk which is the best. And as I said, odds ratio relative risk is used by clinician because it talks directly. AR and PAR both is used by public health expert or government. But which one is better? PAR is better than AR because PAR give information in positive term. So let me explain this third line, why PAR is better, with one more example. Suppose you want that people should not drink and drive. So you can write this information two way. First thing you can write is accident, 60% accident due to drinking, due to drink and drive. This is one way of giving information to public. Second way is, if you don't drink, or if people don't drink, if driver don't drink, accident decrease by 60%. और आप देखते भी होंगे अभी आजकल हाईवेज पे क्या लिख के आता है कि दारू पीकर गाड़ी ना चलाएं क्योंकि आपका घर पे कोई इंतजार कर रहा है। वो ये नहीं कहते हैं गाड़ी पी के चलाओ और ठुक जाओगे, मर जाओगे, वो डराते नहीं है। वो आपको कुछ पॉजिटिव पिक्चर दिखाते हैं कि घर पे आपका कोई इंतजार कर रहा है। व्हाट आई वाज सेइंग इन हिंदी वाज, these days you can see on highway the line that don't drink and drive because someone is waiting for you at the home. They try to give a positive picture that if you don't drink and drive, accident will decrease. This is actually a good way of telling people, because if you tell people in the form of attributable risk that 60% accident is due to drinking, they will ignore this negative information. They will not think about it. They will like to think about positive thing only. So that is why in our life also, if you are giving any advice to your boyfriend, girlfriend, younger brother, sister, don't tell them ki if you will not study you will fail. This is wrong way. They will never listen to this advice. They will ignore it. But if you say it, if you will study, you will get better girlfriend, better boyfriend, better money, better in a positive way. When you tell some information, then people more likely take action. So always suggest people in positive way, because PAR is better than AR. Okay, I hope Anand Krishnan, this example of alcohol made it clear to you. If not, feel free, let me ask. Okay, chalo. So this is the point. Okay, always talk in a positive way. Never try to find fault in people. Try to just find what is good in them, appreciate, and they will love you for them, and your work will be done easily. This is the best management skill, positive deviance. So now let's come to one more topic, evidence-based medicine. What is mean? Evidence-based medicine means, as a doctor, when we take clinical decision, our clinical decisions should be based on data coming from study. It should not be based on our preformed ideas. Like, for example, you must have heard it from your mother, father, or grandparents or someone ki don't eat banana or guava in the evening, it will cause cold and cough. You must have heard it. So suppose you are becoming a pediatrician or a PSM person and a child came with cold and cough. Will you say it first thing, stop giving guava banana in the evening? Will you say it to the patient? No, unless it come from some evidence, unless it come from some previous study data, you will not say it, है ना? You cannot enter into medicine ward and say कि सबको गौमूत्र पिलाओ दोनों तरफ से, है ना? Start giving cow urine to every patient. You cannot say like that. If there is no evidence supporting it, you cannot force your opinion. You cannot take clinical decision based on that. And whenever we take clinical decision, first importance is given to meta-analysis. This is the best study according to evidence-based medicine. Okay, like this is one more common misconception is in some areas in Bihar and all, I have seen that they say that don't eat rice when you have fever. So if rice is causing increase in temperature, then it means all the South Indian population, all the people from West Bengal, Chhattisgarh, or rice eating belt should be hot. Are they all hot? They are hot, but like not hot. You know? It's not they are always in fever. So of course, rice is not causing fever. It's just a old thing, because in old day, usually rice of there was no cold storage thing and all, proper fridge was not there, and also maybe eating that rice can cause some illness. But nowadays it's not related with illness. So we have to take evidence before saying any suggestion to patient. Okay, and the best is meta-analysis. What is that? We will read. But it's best because it compile data and result of many study on one topic. Systematic review also do the same. It compile result of many study. Third number is randomized control trial. Then we have cohort, case control, cross-sectional, ecological, case series, case study, and least importance is given to expert opinion. So what does it mean? It means do not trust on anything which I am telling you in the class. Because who am I? Just an expert. And expert can be biased. Expert can manipulate your mind. So do not trust on me unless my thing is coming from some park textbook or some study data or some experiment on myself or other people. Don't trust without evidence. It's least important. Don't trust me. Okay. Always trust evidence. And they ask question in which you have to remember the sequence of this study. And remembering this sequence is very easy because we have studied it in this sequence only. Only we have studied it in reverse order. Remember, when we talk about one patient, my friend Athar Samim, who had gynecomastia and gastritis, and you are running one patient and trying to write all the hospital story of one patient, case study. And 5-6 people are running together treating their gynecomastia and gastritis. 5-6 people hospital history, case series. Ecological study is done on population. When I said that rural people, rural hospital have less case of gastritis because village people are more active. So I'm not asking it from anyone. We are talking about the whole hospital data of rural PSC and whole population data of villager. That is ecological. Cross-sectional, when I ask it from everyone, do you have gastritis or not? Then we read about case control, gastritis present, absent, and past history. Then we read about cohort. And now we have to read about these three things: RCT, systematic review, meta-analysis. So how they create question from this part. I hope you remember the sequence because we read it in this order. Let's do the question on this topic. One question which they can create from this topic is it the question? Where is the question? Yes. Which study is best to compare effect and outcome? Out of the following four, which is best to compare effect and outcome? Which is best to compare effect and outcome? Which is best? Cohort, case control, case series, cross-sectional. Which do you think is the best? The best is, yes, who is the best? It's not I am the best. No, it's cohort which is the best. Why? Why cohort is best? Because if you look at the sequence of things, very good. Sumaya, Mukund Gupta, Mirja, Anand Krishnan, Swamedeep Sarkar, Manisha, all are right. Why cohort is best? Because in the evidence-based medicine, you can see it yourself. Cohort is above case control, cross-sectional, case series. So whoever is above has a stronger evidence. And the strongest evidence is meta-analysis, not meta-analysis. Meta-analysis is the strongest. So that's why cohort is better answer. If in the same question, if I would have put RCT as an option, RCT can become better answer because RCT is above cohort. But out of the four, cohort is above, so that is the answer. But suppose in the question they ask this question, which is best cause to effect? If they ask cause to effect, which is best, then answer out of RCT and cohort, which one will be best? In that case, only cohort is best. Because cohort study is known as cause to effect. Let me explain this thing to you properly with one more question. Let's do some more question. I will come back to this topic. Why they say cause to effect, then only cohort will be better. I will come to that. But let's do some more question here. First, let's do this question. No, let's do this question directly. Which study is best to detect natural history of disease? This is the question which has came to time. Which is best to detect natural history of disease? किससे natural history of disease best पता चलती है? RCT, cohort, cross-sectional, case control. Which best tell about natural history? Tell me. What do you think? What is natural history means? Natural history means temporal association. See how much I helped you? I gave you another thing here. What is that? What is that? Let me explain this thing. What is this natural history temporal association? Some are saying A, RCT, some are saying B. Of course, if you look at the sequence of evidence-based medicine, then according to evidence-based medicine, RCT should be the answer. But the correct answer is not RCT. Then some student, what they think is history word is written, so they answer case control. But it's not the history, it's natural history. Answer is also not case control. What is temporal association? Temporal association simply means cause precede effect. Cause precedes effect. What does it mean? cause precedes effect. What does it mean? Cause precede effects means परिणाम से पहले कारण. Before outcome, some reason will be there. Let me explain. Why I am drinking water? What is the cause which occur before drinking water? What is the cause? You will say कि मोटे प्यास लगी होगी तो पानी पी रहा है तू. कारण प्यास लगना है, और क्या, इसमें क्या घंटी बड़ी बात है. लेकिन असली कारण ये नहीं है कि मैंने प्यास लगने पे पानी पिया है. असली कारण ये है कि मेरे को कंसेप्ट समझाना था, इसलिए मैंने पानी पिया है. कारण था कंसेप्ट समझाना, वो हुआ पानी पीने से पहले. और ये बात आपको तब पता चलती अगर आपने मेरे पिछले कभी कोई पुराने कोचिंग्स में जितने जगह मैंने पढ़ाया वहां के वीडियो देखे होते, तो हर जगह जब मैं पढ़ाता हूं तो पानी पीता हूं. तो अगर आपने मुझे फॉलो अप किया होता, पास्ट से अभी तक देख रहे होते फ्यूचर में, तो आपको सही कारण पता होता. और फॉलो अप हम करते हैं कोहॉर्ट में, इसलिए कोहॉर्ट से ही हमें पता चलती है कॉज प्रेसिड इफेक्ट. व्हाट आई वाज सेइंग इज दैट माय रीजन ऑफ ड्रिंकिंग वाटर वाज टू एक्सप्लेन दिस concept to you. So the cause was to explain concept which occur before drinking water. And how could you have known it? If you have seen me in other video, if you had have followed me, which we do in cohort study, then you would have known the cause before drinking water. This is temporal association. Let me explain much better in a good example. Because they ask 2-3 questions from it. It's all related with Hill criteria of association. It's a very important topic. Let's understand it properly. Is in your batch some boy or girl is there who would like to do one bike or scooty accident every week or every month? है ना, some खतरों के खिलाड़ी, adventurous person in your batch? My younger sister Mona used to do that thing. She was in 12th class. No, she just joined her BSc, and there was a scooty which she used to drive. And every 2-3 days she used to come and said कि भैया आज एक उड़ाया, आज दो उड़ा दिया है ना. I hit 1% today, I hit 2% today, like that she used to say. And I used to think, why you are doing so much of accident? So I asked her कि why, what was the cause which occurred before accident? She said, what to do भैया, people don't know how to drive. Wherever I took my scooty, they jump in front of it. So she gave a false history. And this is the problem with case control. That's why case control cannot tell natural history. Because in case control, people can tell any history. It will not be the real natural history. So if I want to know the real reason of accident, what I should have done? I should have followed her from another bike or a scooty. Then I would have known the real reason. Only by cohort study I could have known the real reason. But at that time, there was no scooty other than that scooty at my home. So I risk myself by sitting on the back of my sister's scooty. And I did the follow-up why the accident is occurring. So we were about to cross one small bridge above a drainage area. And there was one cycle man coming from that side. So I said to my sister, Mona, brake lagao. है ना? Mona, put the brakes. She said, लगा रही हूँ भैया, I am putting it, bro. Then we went really close and brake was still not applied. So I said, Mona, brake lagao, put the brake. She said, I am putting it, and she hit that man. And then I said, Mona, brake lagana tha na, you should have put the brake. So then I realized the real reason was that at that time her hand was small and it was not able to grab the brake properly. The brake was loose also. So what I did, I took that scooty to a mechanic and I tightened the brake so much that even if you touch it by little finger, it will work. So how could you know the real reason? If you sit on the bike or follow it by another bike, follow up will tell you the real natural history, real cause before accident. So that's why cohort study is the best way to know temporal association or natural history. And then I asked it to my sister, don't the people come and hit you back when you hit them? She said, no, don't worry about that, brother. Whenever I hit a boy, people come, they lift me and my scooty and they say me to go, and they hit the boy himself, saying that you must have jumped seeing girl, you must have jumped in front of her. And no one blamed me for hitting anyone. I said, very good. So this is temporal association. I hope it is clear. Cause was tight loose break which occur before accident. You know it only by doing follow-up. And this point is said by Hill. Hill was a scientist who gave criteria of association. So temporal association was Hill's most important criteria of association. If two things are associated, then the reason must occur before the outcome. Cause must occur before accident. So Hill most important criteria of association is known as temporal association. Okay. Hill actually gave 9 criteria of association because see, Hill has two very important lines. First line is temporal association is most important criteria. Second line which Hill said was, Hill said this second line, ki, what does Hill said? Ki correlation does not imply causation. Okay. What does this line mean? It means कि अगर दो चीज साथ में हो रही है तो जरूरी नहीं है कि एक की वजह से दूसरी हो. If two things are happening together, it's not necessary one is causing the other. For example, let's take a good example. Suppose in this batch, Dr. Some two students, suppose Dr. Mirza and fall in love. Mirza became Mirza Galib, fall in love with some girl. And after falling in love, what do you want? Marks of Mirza should increase or decrease? Let's support love. Mark of Mirza is increasing. So you can see love is in the air, marks is also in the air. And all the friends of the class, they will think that Dr. Mirza mark is increasing because of love. They will think correlation is two things are happening together. So love is causing increase in mark. But only the room partner of Dr. Mirza know the reality. Suppose if let's say Dr. Mukund is the room partner of Dr. Mirza, so only Dr. Mukund can know that since Dr. Mirza has fallen in love, he stopped watching all those web series on Netflix and Prime Video which come, and he is giving that time which he used to give on watching Netflix and all web Prime Video to study. So the marks is increasing not due to love but due to more hour of study. But you will think that love is increasing the marks. So let's take a clinical example also. Let's make it more clear. Government of India said in 2021 that cases of corona came down because of more vaccination. They did vaccination during the disaster, which is contraindicated by WHO. During disaster, we should not give any new vaccine, but still Government of India gave it. And they said this vaccination is causing less case. But there are 5 countries in the world where 95% people were vaccinated. Still, second wave of corona came. China, Seychelles, Israel, USA, UK, all 5 countries, 95% vaccination, still second wave came. It means high vaccination is not causing low case of corona. Otherwise, in those 5 countries, second wave would not have come. So two things which happened together, high vaccination and low case, it doesn't mean high vaccination is causing low case. Most of the microbiologists said that low cases occurred because of viral mutation itself. Because it's a natural life cycle of virus that over the time, virus become less lethal, more infective. समय के साथ वायरस अपने होस्ट को मारता नहीं है, बस उसके अंदर इन्फेक्शन फैलाते रहता है. तो क्योंकि हम मरते नहीं है इसलिए शायद हमें पता नहीं चल रहा है कि कोरोना हो रहा है या नहीं. हो सकता है हमारे अंदर कोरोना ऑलरेडी फैला हुआ है ना. What I was saying in Hindi is with time coronavirus may mutate to cause more infection, less death. And because we are not dying, so we are not knowing what is the spread of corona. And maybe we all are still infected with it. So high correlation does not imply causation. This is the second line of Hill criteria. And in the Hill criteria, there are 9 factors. We will read about all the 9 factors, but let's do this statement first. This was a real question which came in NEET PYQ. They gave a graph between heart attack and C-reactive protein. And you can see the graph itself. C-reactive protein is increasing here, and heart attack chances are increasing in this direction on y-axis. So they say which statement is not correct out of A, B, C, D, which is false, not correct. Option A, high risk of MI is due to high CRP level. Low risk of MI is associated with low CRP level. Higher CRP level, higher risk of MI can be found, or none of the above. So which is not correct? A, B, C, D, which is as a C only, A, B, C. None of the above is not an option, because one of the students said, sir, if none of the above is the option, that is definitely correct. Because not correct is none of the, anyway, that's a double negative thing anyway. Just choose from A, B, C, which is not correct. Tell me, which is not correct? Hey, is Dr. Mirza actually in love also? Do let me know, Mirza. Chalo. Which is not correct to say here? We can see here that when CRP is high, MI is high. So higher CRP, higher MI, this is correct. We can see lower CRP, lower MI. So lower CRP, lower MI is also correct. But we cannot use the word due to. If I use the word due to, it means heart attack is occurring due to C-reactive protein. What is C-reactive protein? That's an inflammatory marker. जब भी शरीर में कहीं भी इंफेक्शन होगा या आप थोड़ा ज्यादा एक्सरसाइज भी कर लोगे तो आपका सीआरपी का लेवल 1 से ज्यादा आएगा, बढ़ा हुआ आएगा. इफ यू डू एक्सरसाइज ऑल्सो और एनी इंफेक्शन इन द बॉडी, सीआरपी इंफ्लामेटरी मार्कर विल बी रेज्ड. सो इज सीआरपी कॉजिंग हार्ट अटैक? नो ना. Due to heart attack, inflammation marker is more, but heart attack is due to some other reason like more BP or stress or some other reason, na, and a blockage of capillaries and all reason. So it's not due to CRP, they are just together. But MI is not due to CRP. Due to, saying due to is wrong. This is not correct. Okay, I hope you understand this line. What does correlation does not imply causation mean? So this is the second important line of Hill criteria. Yes, very good, Swamidip Sarkar, you are right. Because high CRP does not cause high MI. It can be just correlation. That's why A is not correct. Correct explanation. Very good. Now, let's discuss what are the 9 Hill's criteria of association. What are Hill criteria of association? So this Hill criteria of association can be very, what are the 9 factors? Let me tell you. One is strength of association. And which factor tell us about strength of association best? What is the best indicator of strength of association? Filling the blanks. Then there is temporal association. Temporal association. Then there is specificity. Then there is consistency. Okay. And then there is 3 other thing: biological gradient, biological plausibility, coherence. Coherence. So how many criteria? 7. 1, 2, 3, 4, and then 5, 6, 7. After the 7, the last 2 criteria is analogy and RCT, experimental study, is the 9th criteria experimental study, RCT. Now, the question which must be coming in your mind is how to remember these 9 criteria. And this was a big challenge for me also when I was about to teach this topic in classes. But one day I was teaching with my revolutionary friend, Dr. Ajay Verma, and we made a very good mnemonic. We were actually discussing that how can we remove problem of caste system from India. So we created this mnemonic that STSC is a great political controversy, GPC. So what we should do, we should create some experimental village analogy, and that can decrease the problem of caste system. And I will explain why what I was trying to say. But let's first understand this meaning of all this 9 thing. SCST, great political controversy, analogy and experiment. We will explain what does it mean. Strength of association, what is the best indicator? I am sure some of you must have replied. Very good. Relative risk, Soumyadeep Sarkar, Anand Krishnan, Sutapa Samanta, all are right. Best is relative risk. T for temporal association, we just read temporal association means natural history. Cohort tell about it best. And temporal association is the most important criteria. Okay. Then what is specificity? Specificity means cancer, let's say I gave you example, scrotal cancer only in coal tar factory chimney viper. So it is specific. So you can directly tell scrotal cancer associated with coal tar chimney wiping. Similarly, one more association is aniline dye industry worker have urinary bladder cancer. So specific association. Aniline dye industry worker, urinary bladder cancer. So if specificity is there, it means some association is there. And like let's say if a boy of your college is seen only with one girl every time, no other girl he interact or something, then you can say there can be some association because this boy is specific to this girl. No other girl he talks or discusses. Specificity can indicate association, but it is always can. We can never be sure of any one factor. That's why we need 9 factor. Maybe that boy is staying with that girl or being with only that girl because they are good friends, and it doesn't need to have some relationship between them. So it doesn't mean that they are associated. It's just maybe they are just comfortable and all. And so specificity is not the criteria, but it is one of the 9 criteria. It's a very good criteria. But most important is temporal association. Then what is consistency? Consistency means something occur again and again, again and again. Like every winter season, cases of asthma and respiratory disease increases in Delhi. So it is occurring consistently. You can agree ki okay, asthma and is related with increase in pollution in Delhi. Yeah? So it's there. What is biological gradient? Gradient means, let's say if you increase cigarette from 1 packet to 2 packet per day, chances of cancer will also become double. That's gradient. Or let's say when pollution level increases, cases also increases. Cases of respiratory disease also increases. So there is a gradient. Okay. Then there is a plausibility. Plausibility means there must be a biological explanation. Like we can biologically explain that smoking can cause cancer. Biologically, we can explain that air pollution can cause asthma. That's biological explanation. So we can agree that yes, pollution and asthma is biological explanation. It's biological plausibility. Then there is coherence. Coherence means 2-3 departments should conclude to the same result. Like pediatric OPD is finding more cases of asthma. PSM people are finding that air quality index is getting higher and higher, worsening. And pathology people also took the sample of respiratory pathway and found increased inflammatory marker and pollutant deposit there. So patho, pedia, PSM all confirmed that respiratory illness is due to more pollution. Coherence. They come to the same conclusion. Coherent. Okay, that's coherence. What is analogy and experimental study? Let's say experimental study is RCT. So if you want to prove that respiratory illness is due to air pollution, what you can do is catch any 100 children from Delhi and ask them to choose chit AB. Those 50 children who choose chit A, send them to village for next 20 years. And those who choose chit B, let them remain in Delhi. And after 20 years, when all those 50 children will come back from village, hula la la ho, hula la la ho, hula, in all leaf and all, then you compare who will have more respiratory infection. So this is experiment you created. You did intervention of sending them to village, sending them to forest. So RCT is experimental study and done by choosing people randomly. Now, what is analogy? Analogy means same result done when the situation is repeated in different country or different area. Like for example, in Delhi, after increase in air quality index, cases of asthma is increasing. Similarly, in Los Angeles, similarly in New York, similarly in UK, when cases of air pollution, where air pollution increases, cases of asthma increases. So there is an analogy. Every country have this pattern that with more pollution, more cases of asthma and respiratory infection occur. So we can associate that, okay, asthma is associated with more pollution. Okay, so these are the 9 things. And why I said SC/ST is a great political controversy, because we know this SC/ST reservation thing is there, but still, if you roam around in India, 80% of Indian villages still have Harjan Mohalla. 80% of villages have some slum area which is outside the village, and in those slum area, people from oppressed community are forced to live together. That means the reservation has not yet helped those deprived people properly. So it's a controversy, political controversy, which is dividing us people based on some of us agree, some of us disagree. So it is dividing us, but it is actually not helping the real root cause in a big way. It is helping, but in a very small way. So how can we decrease caste system? Let's create some experimental village where there is no caste system. And like in some Tamil Nadu areas and all, there are villages with only father name, not caste title. But still in Tamil Nadu also there is some Harijan Mohalla, slum area with people from oppressed people living in separate area. But some villages, suppose you created in every states, you create one village without any caste problem, without any caste title. So if there is no caste differences, people will be united, and where then they are united, village will grow more. So with this one experimental village in every state, we can make people understand that if caste system is not there, development of village will be more. Because India, due to this caste system, India don't have democracy. India have castecracy. And we are choosing most of our leaders based on caste and all. So this is the 2 places where caste work. One is during voting and another is during marriage. And second, why I am so anti-caste system, because caste system has broken a lot of hurt. A lot of us has breakup only because we are not from the same caste. So it's very anti against caste system. If any of you is supporter of caste system, let me know in the group. I will come into the group and hit you personally, kill you personally also. So I think you will remember this mnemonic, interesting mnemonic, and you will try to break this caste system problem from India, and you will remember the 9 factors of Hill criteria through this interesting story maybe. Okay, check. Now, Swamideep Sarkar has a question that, sir, if temporal association is best and cohort tells is best, then why RCT is above cohort in that evidence-based study list? Very good question, Swamideep. You are a good question. And your question didn't hurt me. See, the point is, in RCT, we are randomly allocating them. And because we are randomly allocating them, there is no chance of selection bias. The 2 group will be very equal. That is one reason why RCT is better and above cohort. But then, point in RCT is, in RCT, we are giving the medicine, we are doing the surgery, we are doing something from our side. So because we are doing something from our side, it cannot be natural. Then it is artificial intervention group. So that is why I said cohort is best to know natural history. Because in RCT, we are not doing the things naturally. We are intervening. We are not letting it happen. Remember, cohort was an observational study, where things occur naturally, we just observe. It's the Dhritarashtra study. where we only observe and we don't intervene. But RCT we intervene. That's why it's not natural history which comes in RCT. And why RCT is better? Because RCT don't have selection bias. That's why RCT is better. And still RCT is above cohort. Why? Because RCT do not have selection bias. And why cohort is best to tell natural history? Because cohort has no intervention. But it doesn't mean cohort is better than RCT. RCT is always better because it where participants are chosen randomly. I hope the answer is clear. क्या समझ में आ रहा है भाई? क्यों कोहॉर्ट नेचुरल हिस्ट्री बताते हुए भी आरसीटी से अच्छा नहीं है? क्योंकि आरसीटी में रैंडमली चूज करते हैं तो सिलेक्शन बायस नहीं होता है. कोहॉर्ट में कुछ करते नहीं है इसलिए वो नेचुरल हिस्ट्री बेस्ट बताता है, बट कोहॉर्ट फिर भी आरसीटी से कम अच्छा है ना. आई होप दिस एक्सप्लेनेशन व्हिच आई गिव इन बोथ इंग्लिश हिंदी इज क्लियर टू यू. कोहॉर्ट इज ऑलवेज लेस बेटर देन आरसीटी. Now one question which Dr. Sutapa Sumantha is asking that, sir, coherence and analogy are same. No dear. Coherence and analogy look same but they are different. Coherence means pedia, PSM, patho, 3 department selected different evidence and prove the same thing. And analogy means same experiment repeated in different places showed that air pollution is related with high respiratory infection like Los Angeles, Beijing, Delhi, UK. Every 4 area have same result when repeating the experiment. That is analogy. And coherence means 3-4 department are providing conclusive evidence to prove the same thing. समझ में आ रहा है? कोहेरेंस का मतलब है कि 3-4 अलग अलग प्रूफ से, एविडेंस से, डिपार्टमेंट से प्रूफ हो रहा है एक ही बात. और एनालॉगी का मतलब अगर उसी चीज को हम 3-4 जगह पे देखेंगे तो सेम रिजल्ट आएगा. एंड एनालॉगी मींस रिपीटिंग सेम एक्सपेरिमेंट ऑन डिफरेंट प्लेस हैव सेम रिजल्ट. कोहेरेंस मींस 3-4 डिपार्टमेंट आर प्रूविंग द सेम थिंग. Does it make sense or do you need more example to understand the difference between coherence and analogy? Coherence is कि all the people of medicine they will tell more alcohol is causing more liver failure. All the people of surgery they will say more alcohol is causing more variceal bleed. All the PSM people will collect data and tell ki in a state where alcohol sale is less, liver failure is also less, variceal bleed is also less. So 3 departments prove the same thing. Is it coherence or analogy? This is coherence. And analogy means that all those countries where alcohol is drink more, they have more cases of liver failure. So same result in different country, that is analogy. Okay, now I hope the difference is clear. But you can still ask me other example if you feel like, and don't hesitate in asking your doubt. Chalo. Manisha want me to repeat the 6th criteria, that is biological plausibility. Biological plausibility means that there is some biological explanation there. For example, if I say that I am fat because I like to scratch my inguinal area. So this is not biological explanation that due to scratching my inguinal area I become fat. There is no biological explanation for that. It's just 2 things which are there. So the obesity cannot be related with scratching of inguinal area, of course. So this is not biological explanation. It means there is no association. But if I say I am obese because of not doing exercise, so I can biologically explain that if I don't do exercise, calorie loss is less, and due to more calorie, I am gaining weight. There is biological explanation. I hope it is clear. Chalo, 6 point. Manisha, is it clear? Let me know. So Swamidev Sarkar Sutapa said it is clear. So I hope Hill criteria is clear to all of you, and you will remember Hill criteria of association. So we have done all the questions from this topic, and it's time also. But in this topic, let's do this one more question here and understand what is meta-analysis systematic review. After understanding that only we will take breaks. Oh, but I have a session on Telegram from 9 also. Oh. So let's do this last question, and I will discuss meta-analysis systematic review in my last session, which will be I think on 29th on 30 in this month. There I will discuss. It's very simple thing. Meta-analysis means you are comparing two things. You are comparing the data and result both. If you combine data and result both, it is meta-analysis. And if you only combine theoretical result, that is systematic review. Like for example, if you want to know that does milk improve sexual performance, because you might have seen that sometimes they give milk before honeymoon night. So if you want to know milk improves sexual performance or not, yes or no, this is theory. And if you are combining 4 study on this topic which are just saying the theory, it is systematic review. But along with combining the result, yes, no, will it improve sexual performance or not, you are also combining the data of testosterone level, serotonin level in the blood after milk. Data plus theory, it is known as meta-analysis. And in meta-analysis, we draw this two things, forest plot, funnel plot. We will read about them in detail in our next class. Funnel plot is drawn to know about publication bias. So what is publication bias? We will read in our next session. What is forest plot, funnel plot? We will read in our next session. And we will do some question also from in the next session from this topic. So let's meet you all on 29th. Sorry for suddenly ending this class, but I realized I have a class at 9. So let's see you there. I hope you must have learned some new thing in this session. Let's see you on 29th. If you have any doubt, question, feel free to post it on the Telegram group of MedEd, SUSHRUTA batch Telegram group. And of course, I will be more than happy to answer you there. Thank you. Plus, you can WhatsApp on me, my personal number, which I have shared in our previous session also. So thank you so much. Love you all. Bye-bye. Thank you.